Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Malignant Pheochromocytoma, and we're looking at the Averbuchs chemotherapy protocol. So under this protocol for malignant pheochromocytoma, there includes the dacarbazine. So this dacarbazine, it is about 600 mg per meter square, and this is on days of D1 and D2. Next is there is the cyclophosphamide. The cyclophosphamide is about 750 mg per meter square, and this will be given on day 1. Next is vincristine. Vincristine is 1.4 mg per meter square, and this is taken on day 1. So all are repeated every 21 days. So they are repeated every 21 days, and this is for 3 to 6 cycles. To learn and grow daily like this, please do subscribe.